The opioid crisis has focused attention on whether too many doctors prescribe too much of the highly addictive painkillers too often. But now a spotlight is on the role that insurers and the pharmacy benefit managers that run their drug programs play in steering patients toward opiates instead of more expensive but less addictive alternatives. Meg Tirrell reports.
Insurance coverage can have a huge impact on which medicines are prescribed and taken by patients. Now, a group of state attorneys general is examining health insurers' role in the nation's opioid epidemic, what they call the preeminent public health crisis of our time. The group of 37 state attorneys general wrote a letter today to the CEO of America's Health Insurance Plans, or AHIP, the lobbying group for health insurers, urging it to encourage members to review their policies around opioids. They asked AHIP's members to, quote, encourage healthcare providers to prioritize non-opioid pain management options over opioid prescriptions for the treatment of chronic non-cancer pain, saying no comprehensive effort to address and end the opioid epidemic can ignore the, quote, ever-increasing number of prescriptions for opioid painkillers. The letter comes after a New York Times ProPublica investigation suggested health insurance policies could be contributing to opioid prescribing. The analysis of Medicare prescription drug plans covering more than 35 million people found that almost every health plan covered common opioids with few restrictions, but that some non-addictive, more costly pain medications require additional steps to receive coverage. Moreover, the investigation found that it can be easier to obtain coverage for opioids than for treatment for opioid addiction. In addition to the letter to AHIP today, New York Attorney General Eric Schneiderman sent letters last week to the 3 largest pharmacy benefits managers, or PBMs, seeking information about their role in administering prescription drug benefits amid the opioid crisis. Both insurers and PBMs say they're addressing the issue. Express Scripts, a PBM, pointed to actions it's taken to prevent opioid addiction, including counseling. And AHIP said in a statement that it shares the commitment of the state attorneys general to eradicating the opioid epidemic in America. Quote, health plans work closely with doctors and nurses on the safest, most proven, and most effective approaches to manage pain, the insurer group said. Many health plans have instituted new programs that are helping to dramatically reduce how much and how often opioids are prescribed. The focus on insurers and PBMs adds to already heightened scrutiny on drug makers, distributors, pharmacies, and doctors, all while the opioid epidemic rages on. For Nightly Business Report, I'm Meg Tirrell.